Good afternoon and welcome to the Multicultural Media Online Forum hosted by the Ministry of Health, Multicultural New South Wales and the New South Wales Multicultural Health Communication Service. I'm Jasusa Helaratna, Deputy Director of the New South Wales Multicultural Health Communication Service. We welcome you today. We'd like to first acknowledge the traditional owners of the land of where we're all meeting. We'd like to acknowledge also the past elders, past, present, and emerging, and extend this to the elders of the multicultural groups who are represented today. For the purpose of this session, Dr. Gale and I will be having our masks off and on for the purpose of us delivering our messages clearly, and for those who may be hearing impaired so they can lip read what we are saying. We'd like to also request for you to please keep your microphones off and on mute, and we'll make sure that we are able to answer your questions. Minister for Multiculturalism, Natalie Ward, and Dr. Marianne Gale, Deputy Chief Health Officer, are here with us today to give you an update. So we'll start. Minister Ward, how are you today?
Hi, Jess. I'm great. Thank you. Great to see you again and great to see everybody. Thank you. Can you hear me all right? Terrific. Okay, I'll get started if that's all right. Yep. Wonderful. Well, thanks, everybody. It's great to be with you all once again, and I very much appreciate your attendance again at this important weekly forum so that we can exchange ideas, hear from you, and have our expression of this information as soon as possible. I also acknowledge the traditional custodians of each of the lands and waters on which we meet respectively, and pay my respects to elders past and present, and thank each of them respectively on the lands that you come from. Look, I know that life in lockdown at the moment is tough. It's tough for many of us, but I want you to know and be reassured that there is light at the end of the tunnel. There really is. Our vaccination rates are soaring. It's amazing to see. The response has been truly wonderful, and I have been absolutely heartened to see those numbers fly. And those LGAs in Western and Southwestern Sydney have been exceptional. They are recording fantastic numbers for first doses. And I just wanted to shout out a couple of them because I just think it's so important to recognise the great work that is being done. Like in Camden, where there's more than 86%, amazing. Blaketown, 85%. Campbelltown, 82%. Parramatta, 81%, really close. And Canterbury Bankstown, 76%. It's almost like we're back at the Olympics again. It's just fantastic to see these amazing achievements. So my message to you is that these are great numbers, but there's still work to do. Let's keep going. Don't stop. Thank you to everyone that's been there for their first jab. Get going to your second and get those bookings in if you haven't already. As the Premier said, no matter where you live, keep coming forward. Just keep coming forward. Don't be left behind. Be a part of this, and we will get to that light at the end of the tunnel shortly. You might have seen today the New South Wales Government is urging international students to come forward and get the jab. We'd just like to remind them that they don't need a Medicare card. They will get a free COVID vaccine. They just have to turn up to one of the hubs. New South Wales, of course, is home to 110,000 international students. It's such a wonderful thing, and we love that they're here. We welcome them with open arms, and we just want them to know that they will get that protection. They just need to go along. And today we've launched 2 new measures to make it even easier for them to find the right assistance during this pandemic. There's a brand new purpose-built website so that international students can easily find that information and the help that they need to get vaccinated, which is really great. Plus, there's an industry toolkit to help those education providers, those agents and community organisations that can communicate tailored information about the vaccine. We're also continuing our partnership with Foodbank, a wonderful organisation to provide thousands of emergency food hampers to our international students in New South Wales. And that program began in August and has continued throughout this current outbreak. And I just want to thank each of them there. So for more information about the support that's available to international students, you can go to scfintakesupport.org.au. I'll say that again, that's scfintakesupport.org.au. It's really important that they know that that information is there and help is at hand. And it's also really important that we keep those conversations going with all of our loved ones about why the vaccination is so important. Because life will look different for Sydney-siders who have had those double doses. And I know, for one, my family and I can't wait to go back to doing all the things that we love. And so we are continuing to make sure that we really want to emphasise that to everybody. Please look for that light at the end of the tunnel. Please get the double vax so that we can all get out there and get back to doing what we love to do. The New South Wales Government is continuing to listen and respond to feedback from community leaders and multicultural media outlets, crucially, as we navigate our way through this pandemic. And again, I want to thank you so very much for the direct feedback I've had, for the opportunity to hear great ideas, great initiatives, and great feedback about where we can improve and what we can do better from our leaders. And the crucial role of our multicultural media outlets. It's just wonderful that we're partnering together to walk through this journey. Of course, applications have now closed for the $3 million slice of our $18 million funding package that I announced last month. And that will go to those grassroots organisations who are helping vulnerable members of our community during this difficult time. We were keen to get that money out the door and through to those people who need it most as quickly as possible. That, of course, will assist recent migrants, our young people and our seniors. And it's just such an important initiative. It will help those who are really struggling during this latest outbreak. That package will be integral to helping those organisations who really know communities best, those organisations who can deliver that emergency food relief, promote the vaccination and testing services, and provide that culturally appropriate support and care to all those diverse communities. We've heard that that's so important. We've acted on that immediately, and I just want to thank them for the amazing work they're doing. Grants of up to $30,000 will be allocated to those successful not-for-profit and multicultural community organisations. I'll have more details on that soon, along with other sections of the funding package and more really good news. I'm so excited to be able to share that with you very shortly. It's also just great to see the SBS live interpreting partnership, which covers more than 10 languages now. Just phenomenal. Who would have thought? Out of this has come this amazing initiative, and it's just a great achievement. I just want to thank all the interpreters again for their wonderful work. And it's just been such an important way to reach all of the corners of our wonderfully diverse community. I'm so grateful to all of them. And I'll just finish on this, but finally, you might have received by now my first message from the Minister column. It lists support services and funding packages that are available to all those people in our community who need help during this pandemic. So I do hope it's helpful. I really appreciate you conveying that through so that people can access that information as quickly as possible. And I'd be grateful if you consider publishing that column so that you can reach your audience with that important information. So I will leave it there. Thank you once again, and look forward to your questions.
Thank you very much, Minister Ward, and it's great to hear those two measures and those important measures and some updates from you. And now we'll hear an update from our Deputy Chief Health Officer, Dr. Marianne Gale. How are you today?
I'm very well, Jess. Thank you very much, and good afternoon, everybody. So in New South Wales to 8 p.m. last night, there were 1,480 new cases of COVID reported that were locally acquired. And sadly, today we reported the deaths of 9 people in our community. As Minister Ward said, while obviously these high case numbers are a concern, the really good news is to see the increasing rates of vaccination across our state, and particularly across those most affected areas in Greater Sydney. And we're really pleased about how people are coming forward to get vaccinated. It's really terrific, and a big thank you to the community for hearing that message about vaccination, for taking that up for yourselves, for discussing that with your family, and for discussing that and encouraging your community and your friends to come forward for vaccination. So we're really optimistic that we're going to see those numbers increase even further. And from the perspective of New South Wales Health, we really want to see vaccination rates and vaccination coverage get even higher than 80%. And we really think in New South Wales that we can do that. And so a big thank you to all of you for your efforts, and for you in multicultural media for continuing to promote that message. Some of the issues to be aware of today, we are concerned about some of the suburbs, or some different suburbs where we are seeing increased cases. And so today we particularly mentioned suburbs in Waterloo, in Redfern, Glebe, and also Marrickville. So if you are living in those suburbs or nearby, please be vigilant for symptoms. Please particularly follow the public health advice, and please take every opportunity to get vaccinated. There have been some new vaccination clinics with Pfizer set up by the Sydney Local Health District, and they're open this week and over the weekend in Ashfield, in Marrickville, in Glebe, and at various other locations. So please do have a look for that, available on the website. And if you haven't already had access to a vaccine and you live in those areas, please come forward as well for vaccination. In the regional areas, we are concerned about some sewage that has detected COVID, where we are not aware of cases in the area around Port Macquarie, in Bonny Hills specifically. And we continue to see cases in other parts of regional New South Wales, including in Western New South Wales, in Far West. We are seeing increasing cases in the Central Coast area, as well as in Illawarra, Shoalhaven. So it's really important reminder for all our regional communities as well to remain vigilant, and please take all opportunities that you can to get vaccinated. So I'll leave my comments there. Thanks very much, Jess.
Thank you very much, Dr. Gale. We have our first question from Argiro Bordumpa from Greek Herald. New South Wales Premier Gladys Berejiklian is aiming for a target of 70% fully vaccinated by mid-October for people to get more freedoms. Although New South Wales is close to that requirement, the case numbers continue to remain high, which fosters confusion and doubt in the minds of multicultural communities about whether the vaccines are actually working. In turn, this encourages vaccine hesitancy. What are your thoughts on this, and what can the media do to continue to encourage vaccination? Minister Ward, would you like to start?
Yes, thanks, Jess. Yeah, look, quite simply, we've got two fantastic vaccines and they both work. You only need to look at the modelling from the Medical Research Organisation at the Burnett Institute, which shows what would have happened if there hadn't been that vaccination rollout and if there hadn't been those restrictions put in place. And that institute found that Sydney's lockdown and the vaccine rollout together have prevented almost 5,000 deaths and almost 500,000 COVID-19 infections. That's really stark. The death toll in those hotspots could have been as high as 5,800 according to that modelling. So they're sobering numbers. And those measures that we have put in place have helped save lives. There's just no doubt about that. So getting vaccinated saves lives. So I'd encourage the media to keep doing exactly what you're doing, stressing the importance of vaccination. And we know that we have that modelling to demonstrate what it has done. People just need to look at the trusted health advice and not get any of that false information, that misleading information from social media. So I'm just truly grateful for all that you have done and all you're continuing to do. Please keep that messaging going. Get vaccinated to keep yourself, your community, your family safe. But Dr. Gale might have more to add to that on the health specifics.
Thank you, Minister Ward. Dr. Gale, there's this hesitancy. What is the media? What is your message for the media to continue to relate the messages?
Thanks very much, Jess. And look, absolutely, the vaccine is a critical part of us getting out of this situation and is already playing a part. So, for example, as we will have seen this year, we haven't seen as many cases and severe outcomes, including death, in older people in aged care facilities. And a big part of that is because many people in aged care facilities have been vaccinated in these months before Delta hit us. And really the alternative, if we didn't have such good coverage of vaccination in aged care facilities, potentially what we would have seen is something far worse with this Delta outbreak. So there is evidence that vaccine is working. It is protecting people. We've seen that in the aged care sector with this Delta outbreak. And of course, we have had cases in aged care. We have had outbreaks. We have sadly had people lose their lives. But what we need to be thinking about is what the alternative would have been if we didn't have the vaccine coverage that we've got. And I can understand the community might feel that with the high case numbers and the increase that we're expecting, that vaccination and the lockdown and the restrictions that we have are not working. However, that's not the case. The question to ask ourselves and the thing to compare against is what would have happened if these things were not in place. And what experience overseas has shown us, and what we know about the Delta variant, is that if we didn't have the contact tracing, if we didn't have the restrictions that are in place, if we didn't have the vaccine, what we would be seeing is a lot more case numbers. So it is working, the measures are working. This Delta variant is just very transmissible, and so we are going to see cases, but everything that we're doing, including vaccination and everybody's concerted effort across health, across other government agencies, but most importantly, you and in the community, it is working. And I think it's really important for people to be proud of that and understand that even though we've got the case numbers, the measures are working, and it's really important for everybody to play their part and particularly take up vaccination, which is going to be absolutely key for us to get out of the situation.
Thank you so much, Dr. Gale. A question from Fred Zhang from Sydney Today. On behalf of the Chinese community in Sydney, Sydney Today would love to ask the following questions. We are told the state is opening up as we are reaching the vaccine target. However, many parents are worrying about their kids as kids have restricted access to vaccines. Several newborns are already in ICU now in Sydney as they caught COVID. Is it too early to open up? How would the government protect our kids? Minister Ward.
Thank you, Mr. Zhang, for the question. It's an important one, and we know that protecting our children is paramount. The New South Wales government always follows the health advice, and we're really clear about that, and we've been absolutely upfront about that, and we've, that's guided us throughout. I know the Department of Education has developed a plan to bring students back to school in a COVID-safe way, and it's really important that we ensure that continuity of education while we're protecting student safety, teacher safety, and our community safety, of course. As we know, a staggered return of students to face-to-face learning will start on Monday, the 25th of October. And of course, Year 12 students are already able to return in a limited way, and that will continue for the rest of Term 3. From 25 October, Year 12 will have full-time access to school campuses and to their teachers, and I just want to thank those teachers and those schools that are putting those plans in place so well and have provided excellent controlled environments and following that health advice. If those stay-at-home orders are lifted in an LGA or a region before 25 October, then on the basis of health advice, all students living or learning in that area will return to face-to-face learning under the department's COVID-safe schools framework, of course. If there are cases in certain LGAs that increase significantly, learning from home will resume for that LGA until those case numbers drop. So we'll be guided by that evidence-based expert health advice approach. Of course, HSC exams have been delayed that 1 month, and vaccinations for all school staff across all sectors will be mandatory from 8 November. So students who are eligible for the vaccine are strongly encouraged by the government to get one. My son is doing his HSC right now, and he's had his first jab. So we know that that's really important to getting them back into that routine, because we know students learn best in the classroom. I know from my very own family, and we're ensuring this return to school is done in the safest possible way that we can assist.
Thank you, Minister Ward. Dr. Gale, what is the health message to protect our kids?
Thanks very much, Jess. Look, we know in this Delta outbreak that we have seen greater numbers of young people affected, including higher numbers of children. And just today, we had a report released from the National Centre of Immunisation Research and Surveillance, who we've been working with since the beginning of the pandemic to look at transmission in children, and particularly in school settings and early childhood settings. And essentially what that study and their intensive analysis and work over many, many months has shown is that, yes, with Delta, we are seeing more cases in younger people, but the majority of young people have very mild disease or are asymptomatic. And as we would expect with anything where there are big numbers, there are going to be people as well and children who do become sick, and some children who are in ICU. However, the vast majority of children who are affected have mild or asymptomatic disease. And so it's reassuring for us as a community and for the parents out there that that is the case. And only around 2% from the study released today, 2% of children require hospitalisation, and even a smaller number might require ICU support. And of those children who do require hospitalisation, sometimes children are in hospital because of more social circumstances. So when a household is affected, that their parents might be seriously unwell and unable to care for them, and hence the child is in hospital. And we know that our Sydney Children's Hospital Network is caring for over 2,000 children and providing them a wonderful service that incorporates all their learning needs, incorporating virtual models, play. So there's a lot of work going on to take care of our children during this pandemic. So I think clearly the transmission in young people is a concern. However, the majority of disease is mild, and it's something that we actively work on between health and education and with our academic partners as well, to make sure that we make the best decisions to protect the health and well-being of our young people as we go forward in the coming months.
Thank you so much for that, Dr. Gale. Pawan Luthra for the Indian Link. Question for Minister Ward. Minister, there are obviously people in New South Wales who may not be eligible to be in Australia. We still want them to be vaccinated without getting involved in their visa status. What is the plan for them to get their vaccine certificates? They obviously cannot access these from the MyGov website.
Oh, thank you, Mr. Luthra. That's a very good question. I understand it's a challenge. We want everyone to know that everyone is able to get the vaccination. We're absolutely clear about that. Vaccination is available to everybody. You do not need a Medicare card to get that. So we're absolutely clear, and we want everyone to know that that is available to them. In terms of the proof of the immunisation, they can get that. They don't need a Medicare or MyGov account to get that. They can get that from the Australian Immunisation Register, and that register will have that information, record that for them. So we know that that will be there, absolutely. We want to make sure that everyone knows the vaccine is available for them, and they'll be most welcome at those government vaccine hubs to get that jab and get the second one.
Thank you very much, Minister Ward. Another question here from Sydney Today. One of our readers took Sinopharm shots when he was in China, and after he came back to Sydney, he was vaccinated. He was rejected by his employer as his vaccine record is not acknowledged. When he went to the vaccine hub for Pfizer or AstraZeneca, he was already also rejected because he's considered as already vaccinated. What is the government's solution to this situation?
Thanks very much, Jess, for this question. Look, it is an issue. We note that these instances are occurring, and we're working with the Commonwealth or the federal government to provide guidance around these situations and to make sure that these issues are captured as we go forward, noting that people from overseas may have had different COVID vaccinations, but it is something that we are actively working on the Commonwealth with, and looking at advice from ATAGI and so forth as to how these situations are managed, where people might have had different vaccines overseas, perhaps both doses, maybe just one dose, and how do we manage that as a system going forward. So we note that issue, and there is work underway.
Thank you very much, Dr. Gale. Natalie Parish has a question. Deputy Premier John Barilaro, public said curfews don't work and that the reason they were implemented in Western Sydney and Southwestern Sydney was because of media pressure. Will the curfews in the 12 LGAs be lifted? Minister Ward, would you like to comment?
Yeah, thank you. It's a great question. Obviously, the curfews are there based on health advice, and equally they will be lifted when it is based on health advice that it's safe to do so. So from the outset, we have relied on that expert advice, and we will continue to do so where it's necessary. And I just want to thank everyone for the great work that they're doing in each of those areas. I know it's not easy, and that's being conveyed. We're all well aware of that. But certainly those restrictions, when we're getting through, and we're seeing with vaccination numbers, we're seeing with the outcomes that those things can be very helpful. So as soon as the health advice is that we can lift those restrictions, that will absolutely happen, and we're all very keen to see that.
Thank you, Minister Ward. Dr. Gale, would you like to add on to this, to the comments?
Oh, thanks, Jess. Look, just to add that clearly there's no one intervention in and of itself that works on its own. Like everything that we have been talking about and everything that has been in place, it really is about a constellation of different interventions that result in a cumulative effect, which is what we're trying to achieve. So we've talked about the importance of contact tracing that we continue to do, the importance of the restrictions to reduce people's physical contact with each other, reduce people's movements. We've talked about the importance of vaccination and getting those vaccination rates high. We've talked about the importance of prompt testing as soon as you have even the earliest of symptoms. So there is a constellation of interventions, and curfews are just one additional element of a suite of different things that can be useful in different communities at different points of a pandemic to control the situation that we're in. So we will always consider all health measures, including curfews, and respond to the changing pandemic, the data that we're seeing, how vaccination rates are improving, how people's movements might be improving, the demographic, the areas where we're seeing transmission occur, and we will always consider that and advise government accordingly.
Thanks so much for that, Dr. Gale. There's a question from Juliet Kerwood. The money released to Red Cross for asylum seekers and refugees was not enough to support all the people who need it. There are clients who are not able to access the support because Red Cross was inundated. And will there be more money released? Minister Ward, would you like to answer this question?
Yeah, thank you very much for the question. We did have the urgent support package worth $18.8 million that we've just announced to help our most vulnerable during this difficult time. And I want to thank those non-government organisations, including Red Cross, who've been getting that out the door. We wanted that to happen quickly, and so we made that quite a relatively simple process, and we made sure that happened as fast as it possibly could to get that resourcing straight out to those communities. Of course, there was also the $6.25 million funding boost for temporary visa holders, particularly asylum seekers. We heard from community that had to be done and had to be done quickly, and so we responded to that as fast as we could. And I just want to thank each of those organisations. We, of course, had the additional grassroots community-led grants, which was a $750,000 urgent program, and that was through 150 different multicultural community organisations. But we have heard that more is needed, and so there is good news coming on that front, absolutely. And I will do everything I can as your Minister for Multiculturalism to make sure we are getting those resources out there. We're working through the final details of that today, but I should have something to announce on that very shortly, and that should be record funding in this space. But so watch that, it's not far away now. Thank you very much for the question and for your concern for those communities.
Thank you very much, Minister Ward. And we've run out of time again. It's 4:29, and just tossing it back to you, Minister Ward, for your last words.
Yes, I just want to once again thank you and emphasise we are getting there. We really are. And I'm just so pleased with those numbers that are doing so well on our vaccinations, particularly in those LGAs. But I particularly want to thank our multicultural media for getting those messages out and ensuring that our communities can receive that in language, in the channels that they know and love and respect. to each of you. I'm really pleased with the announcements that have been going out, and I just want to shout out to everybody at Multicultural New South Wales. We've got now a new record, 2,600 translated resources out there in, of course, almost 60 languages. So I'm really pleased about that. I just want to thank everybody for their great work.
Thank you so much, Minister Ward. And Dr. Gale?
Thanks very much, Jess. Look, again, for me, a big thank you to our multicultural communities. We know these last weeks and the last months have been tough. Very difficult for families and for communities, and we do recognise that. But a big thank you to everybody for listening to the health advice, for coming forward to getting vaccinated in the great numbers that you have, look, a big thank you to everybody for all your efforts, and to please keep it up. And as Minister Ward said, you know, we're on a pathway to get out of it. There is light at the end of the tunnel. Things may get a bit worse before they get better, but if everybody bands together and continues to follow the health advice and come forward to get vaccinated, we have a lot to look forward to in the coming months. So thank you.
Thank you so much, Dr. Gale and Minister Ward. And thank you to you all for joining us for this Multicultural Media Online Forum. It's been 3 months since we've started these sessions, and we're really, really thankful for you for joining us. If you want the recording, please go to the New South Wales Multicultural Health Service website, and we can send that through to you if you email us as well. For all your questions, for all your support, thank you so much. Have a great day and stay safe.